Over the last 2 decades, the discovery, commercialization, and restriction of synthetic transvaginal mesh in female pelvic floor reconstruction has drastically impacted the practice of pelvic floor surgeons and gripped the lives of some of our patients. My name is David. I'm a junior clinician undertaking a PhD at the Hudson Institute of Medical Research in Melbourne, and my PhD focuses on assessing the efficacy of novel bioengineered cellular surgical constructs for the surgical management of female pelvic floor dysfunction. I have no affiliations to disclose, and I thank ICS for the opportunity to present. As we know, potential postoperative complications from polypropylene mesh insertion transvaginally range from chronic pelvic pain and sexual pain to issues associated with the mesh such as mesh extrusion, erosion, and migration. These adverse events are associated at a macroscopic level with the incompatibility of the mesh with the unique dynamics of vaginal tissue, and at a microscopic level, there is an exaggerated foreign body response owing to increased matrix metalloproteinase activity. This finally results in poor tissue integration and disrupted integrity of the histological layers of the vagina, making it more likely for the mesh to be exposed. Through nanofiber electrospinning, we have created PLCL meshes that not only have the potential to provide physical support to tissue, but they can also serve as a microscopic scaffold for therapeutic cells such as endometrial mesenchymal stem cells to adhere. These are therapeutic cells that exist within unique perivascular niches within the uterine endometrium and have been implicated in improving tissue repair after mesh insertion. Thus, we hypothesize that when endometrial mesenchymal stem cells are combined with nanofiber meshes, the foreign body response is limited, and this combination of factors may serve as a potential therapy for POP. The aim of this study was to optimize nanostructured PLCL mesh by combining them with endometrial mesenchymal stem cells in a preclinical large animal model of POP. To do this, we constructed our PLCL nanomesh, integrated it with human EMSC, and then performed posterior repairs on multiparous U's divided across 3 groups. These electron microscopy images demonstrate the high surface area of PLCL nanomesh after electrospinning, and demonstrate the adherence of EMSC through filopodias that allow it to stick to the mesh, adhere to it, and also sometimes disappear into it. Our study demonstrated improvements in mesh tissue integration, with minimal loss of tissue at the mesh tissue interface in both the PLCL only and PLCL plus EMSC groups. Out of 28 surgeries, there was only 1 instance of mesh exposure. Histological findings of good integration correlated with objective measures of vaginal tissue loss. Previous polypropylene mesh insertion has resulted in the loss of tissue specifically at the lamina propria, as this is most commonly where the mesh sits. In this study, there was largely no significant difference between the lamina propria or muscularis thickness in the sham, mesh, or mesh plus cells group. Also, compared to our control of non-operative multiparous U's, we were unable to demonstrate any difference in the thickness of these layers. EMSC significantly improved smooth muscle content in vaginal tissue. This is exhibited in the 90-day group between the sham, mesh only, and mesh plus cells group, at 7 days between the sham and mesh plus cells group, and between the 30-day mesh group and 90-day mesh group, and 30-day mesh group and 90-day mesh plus cells group. This correlated histologically with focal deposition of smooth muscle around the mesh within the PLCL nanomesh slides that were stained for alpha smooth muscle actin, appearing brown here. This scanning electron microscopy image demonstrates nanomesh integration at the nanoscopic level, with new collagen fibril formation bridging the gap between this nanomesh here and the vaginal tissue architecture here at these levels. On the left is Mason's trichome staining of PLCL nanomesh and PLCL mesh with cells. Both groups demonstrate adequate collagen staining surrounding the mesh, appearing here in blue. The conclusions of this study are that electrospinning is an effective method of nanomesh fabrication that has potential applications in POP. EMSC combined with PLCL, nanomeshes have improved mesh tissue integration and smooth muscle formation within the healing response. And the degradable nanofiber meshes have demonstrated improvements in the maintenance of vaginal wall integrity and prevention of tissue loss after insertion. Overall, stem cell boosted PLCL nanomesh have significant potential as alternative surgical constructs for the treatment of prolapse. And I would like to thank my supervisors and colleagues across the Hudson Institute and Monash Health, without whom none of this work would be possible.